Hello everyone. In this video, I will be sharing and highlighting a lipid-lowering therapy, NEXLETOL bempedoic acid, which was initially approved by the US FDA in February 2020. Bempedoic acid is an oral once-daily small molecule medication for reducing low-density lipoprotein cholesterol, LDL-C, in adults with hypercholesterolemia, as well as to reduce the risk of major adverse cardiovascular events. Now, let's dive into this medication in more detail. Bempedoic acid, brand name NEXLETOL. This medication was initially approved by the US FDA on February 21, 2020, and currently indicated to reduce the risk of major adverse cardiovascular CV events, CV death, myocardial infarction, stroke, or coronary revascularization in adults at increased risk for these events who are unable to take a recommended statin therapy, including those not taking a statin, as an adjunct to diet and exercise, in combination with other low-density lipoprotein cholesterol (LDL-C) lowering therapy, or alone when concomitant LDL-C lowering therapy is not possible, to reduce LDL-C in adults with hypercholesterolemia, including heterozygous familial hypercholesterolemia (HeFH). Chemically, bempedoic acid is a symmetrical small molecule prodrug with a secondary alcohol functionality in the middle and dicarboxylic acid motifs on both ends. Molecule weight 344.5 gram per mole. Hydrogen bond acceptor 5. Hydrogen bond acceptor refers to the number of nitrogen and oxygen within the drug molecule. Hydrogen bond donor 3. Hydrogen bond donor refers to the number of OH and NH groups within the drug molecule. Log P 3.72, which is a lipophilicity parameter for the drug molecule. The higher log P, the more lipophilic drug molecule. Polar surface area 94.8 square angstrom. This medication is available as tablets. The strength of tablets is 180 mg. Recommended dosage 180 mg taken orally once daily with or without food. Mechanistically, this medication is an oral prodrug which needs to be converted to the active CoA thioester metabolite in the liver. The activated CoA thioester form works as an adenosine triphosphate citrate lyase (ACL) inhibitor, targeting the hepatic cholesterol biosynthetic pathway, therefore lower the bad low-density lipoprotein cholesterol (LDL-C) in the bloodstream. Also notably, bempedoic acid works within the same pathway as the statin class, but the ACL enzyme target is located on the two-step upstream level compared to the statin target HMG-CoA reductase. However, bempedoic acid is only activated in the liver, not in skeletal muscle. Therefore, it's less likely to cause the muscle-related side effects. Pharmacokinetically, Tmax, that's the median time to reach maximum serum concentration, was 3.5 hours. The mean half-life of bempedoic acid at steady state was 21 hours. Protein binding was 99.3%. The apparent volume of distribution of bempedoic acid was 18 liters. Metabolism. Bempedoic acid primarily goes through phase 2 conjugation with glucuronic acid. Bempedoic acid is also reversibly converted to an active oxidation ketone metabolite by aldyl ketone reductase. Excretion in the feces 30%, in the urine 70%, mainly as phase 2 glucuronic acid conjugates. Less than 5% was excreted as an unchanged parent drug molecule from feces and urine combined. Drug-drug interactions. NEXLETOL increases statin plasma exposure. Therefore, avoid concomitant use with similar statin greater than 20 mg or prevaristatin greater than 40 mg. Fibrates. Concomitant use with NEXLETOL increases the triglyceride level and decreases high-density lipoprotein cholesterol (HDL-C) in certain patient population. Contraindications. History of a serious hypersensitivity reaction to bempedoic acid or any of the excipients in NEXLETOL. The most common adverse effects greater than or equal to 2% from primary hypercholesterolemia trials: upper respiratory tract infection, muscle spasm, hyperuricemia, back pain, abdominal pain or discomfort, bronchitis, pain in extremity, anemia, and elevated liver enzymes. From cardiovascular outcomes: hyperuricemia, renal impairment, anemia, elevated liver enzymes, muscle spasm, gout, and cholelithiasis. Here is a key source which I have used to prepare for today's video. Most of the medication information which I share today is based on NEXLETOL prescribing information. This document is available at the US FDA drug website, along with the drug manufacturer website. Finally, I want to thank you all so much for watching. If you find this video helpful, subscribe for future medication video updates. As always, keep learning and elevating. Thank you so much.